Water is life. But for the vulnerable population residing in Gbaninga and Yengsa villages in Bond District, southern Sierra Leone, access to safe drinking water often requires long, arduous hours of walking to the nearest stagnant surface water, which may have also been used for bathing, washing clothes, and cleaning kitchen utensils. These communities are miles apart, but their stories present a picture of the pains communities have to undergo when they lack potable water. 13-year-old Mariama is a Class 6 pupil of the Bond District Council Education Primary School in Yengsa. Mariama has an ordeal with the water situation before World Vision intervened in her community.
Life been bad for because the water we drink now, the water is red, in color change, and jams and then inside back. Now inside they book, they wash inside and they drink and back. And they give you disease.
Mosu is 11 years old and she is a Class 4 pupil at the Bond District Council Education Primary School in Gbaninga.
World Vision matter and join the build. Morning going join the Michael Jawala, my wanting Pusatambo, Nwasatapo in China, our Yehu, my engine, Macro, Jingle, our pencona, Jinjana, Aboyo, my Akuma Crewan.
The old as well as the young were all battling with the poor water condition. Madam Mamako Sandi is a chief in Yengsa.
Jena Mokpoima or the Hawatijima. Jena Belina Lemo, Tawa Makomo, we are Gunja Kama. Jena Mokpoilo, what's Yamako Levio Moete, Jumulenga Tiha, Dengatiha, Paquesa to what's a hilo, Gitty and Jejiboy. We are Jejiboy, Mugo Huani, Nasa and water willow. Nungana or see our Hagaman, a collecting gay with Tuala. May have him moved to a bit of tell Matame. Him or ye in the night will. Give my Mola Nayala, no him aquamuruma. Piasuja himuruma.
Hassan Muniru is a health worker at the Gbaninga Community Health Post. Hassan paints a clear picture of how bleak the situation was before World Vision intervened in his community.
The water situation here was very poor. Very, very poor in terms of adequate, in terms of water security, and in terms of the safety for human use. So most of our constraint here is that one towards health is that we hardly complete our monthly target. Our target in terms of delivery. So most of women, pregnant women, go far away in terms of delivery. They go to other centers because of lack of water supply in our center. So at times, if they happen to come, we have to send their relative at a distance, which takes almost half an hour to bring that water to purify the health center or to purify the health workers, to purify even the woman that has delivered. So this is one of it. And we see that also in our statistics, in our report, we find out there are several water-related diseases. Think about diarrhea, you think about that of dysentery, think about typhoid, skin infection. It's always around our community. So last year, and this year, January to September, for skin infection, we have 50 people that we are affected due to water. And then for diarrhea, we have up to 152. Both male and female, children under 5 are among this group who was affected because of poor water facility.
Then just so it will cause diarrhea. Yeah, at the same time, it causes cholera. The cholera now, it kills about 4 or more people within a week time.
Safe drinking water is essential in improving the health of communities, and the World Vision UK-sponsored water project is making a huge change in Gbaninga and Yengsa communities.
Now the difference because now they drink clean water. Now bush be they go na yard. Now they feel fine because we don't get this toilet here now. They go far place if we go get water.
The 200 nya feel fine. Get agba school ga wan bendo. Pump you na squilla. Ganje go na nya feel fine. Nya go na go.
Na wa biso wan jeje iwala pepe ngo muva. Mo polo e mo go hunle mo le ngata polo e gungo le sesengo wa. we na enje itana mu ba mu poema ye na office opinion mu for amasene osene ovengwa mu sebwanga ma ya manasa tulunga ti enje gibunda majo tabe ngo piti majo.
A lot of changes has taken place. In September it was 17 diarrhea cases for children under 5, and for this month is 11, so drastically it's coming down. And compared to that of diarrhea, it was 9 for September, and this month was just 4 for children under 5. So the 5, you see the gap there. So it's really helping us to improve the health of the people living here. That is good for drinking for us, and people no longer suffer in terms of fetching water. They are really happy. Most of our health workers happy to do delivery now, and the women coming to attend clinic are very happy because we have to give them water to drink. Even in terms of taking drugs, you need water. So that is one of the improvements.
Water is vital for human development. It is beyond doubt one of the most critical prerequisites for any kind of sustainable development. The borehole water supply is bringing residents around Gbaninga and Yengsa closer together, uniting them in their shared responsibility of caring for the boreholes and reducing the likelihood of unsafe water sources causing intestinal or waterborne diseases. World Vision International Sierra Leone, through the support of World Vision UK, facilitated the drilling of the 2 boreholes in the 2 communities, providing clean water to approximately 2,098 people.